before you invite your kamag-anak or relatives here, you have to think 100 times first.
It was supposed to be a family reunification in Alberta, but instead, it's become a financial nightmare. A family warning others as they look at sending their 74-year-old father home to the Philippines with no immediate way to pay a healthcare bill set to cost in the hundreds of thousands of dollars.
Oh Canada, oh Canada.
Bernardo Puno's lifelong dream was to experience snow in Canada. The dream coming true in 2019, making the trip from the Philippines to Lethbridge to reunite with his family.
We brought him to Banff. We went fishing, camping. It was the happiest days of his life.
The 74-year-old applied to become a permanent resident here in Canada back in September 2020 through the parent-grandparent program. But after 2 months, according to the family, Puno started acting differently.
The doctors told me that he has a stroke, and it's a huge one.
Puno has a visitor visa without health care and does not have travel insurance. Because he had applied for permanent residency, the family attempted to apply for an Alberta health care. During the hospital visit, the facility only provided general nursing care because of the underlying uncertainty of how a hospital bill would be paid.
It's so frustrating, we don't know what to do next.
There's no final bill yet, but the estimate is expected to be close to $400,000. Puno's visitor status is set to expire next month, and they haven't heard back on his permanent residency application. His condition is getting better and is now medically stable. Now the family is facing the difficult decision of whether to send their father back to the Philippines, which will cost another $55,000.
Here, like paycheck to paycheck.
We also reached out for comment to the Philippine consulate but didn't hear back by broadcast deadline. We reached out to Alberta Health Services, who say they can comment on specific cases, but did say in a statement, "We are very sorry to hear about this patient's recent health concerns. We also understand the associated medical bills may be a burden to them and their family. In cases where AHS is unable to make arrangements with patients to transfer their care to their home province or country, other government agencies may be asked to assist. The family has this advice for those who have visitors from another country."
I suggest you gotta talk to the insurance company right now, right away.
For City News, I'm Omni's Theresa Redula.